Hello and welcome, everybody. We've got a small group today leading up to the holidays, but we're so excited that you're here and you've joined us today. Um, you probably all know Dr. Akil, but I want to tell you just a couple of really interesting things. Did you know that he's been practicing in the US for over 45 years? He's a practicing physician in the US for over 45 years. And there's a really cool story around how when he first came to the States, and he had to start all over again because he had been practicing as a physician in Bahrain. And again, cool story. One day we're going to have to ask him to share that with us. But he's been practicing now in the US for over 45 years, and he's continuing to make such a huge impact on everyone that he serves as a physician and as a teacher. And today he's put on his teacher's hat and he's come to us to bring us some really great information about how to navigate migraine relief. So, Dr. Kill, thank you. The stage is yours, and thanks for doing all that you do.
Thank you so much, Lynn. I appreciate your kind comments. And yes, I did spend 11 years in Bahrain in the American Naval Base. And one day I shall share that story with you all. My experience over 40 plus years, I have seen several people, patients who have come in like this particular picture shows, like a thunderbolt headache. And it is such a headache that the person, we actually have to put the lights off in that examination room. The person is lying in a crouched position, like a fetal position, and holding her head. And at one time, I remember a lady telling me that I wish I had a gun and I would have shot myself. So it is that type of an excruciating pain. And listeners and viewers who have been here, who have been there, will understand what I'm talking about. So, what are migraines? See, migraine is more than just a severe headache. It's a very complex neurological disorder. Some things that we are really even now trying to understand. And that comes with a range of symptoms. Now, the term migraine comes from the Greek word hemicrania, meaning headache on one side of the head. This headache has been described by patients over a period of time that I've been in practice as a stabbing, throbbing, pounding, piercing, pulsating, intense, so much so that it debilitates them even to carry on their usual functions. It's also often accompanied by nausea and vomiting and extreme sensitivity to light and sound. Migraine attacks can last for hours to days. And trust me, that the pain can be so bad that it interferes with your daily activities. And despite improvements in treatment, migraine remains an underdiagnosed and undertreated condition. So the next step I would say is let us go step by step so that we understand this problem. The first problem is your risk factors. Identifying these risk factors can empower everybody to understand and manage the migraines better. Your first risk factor is family history. If you have had your parents, if you had your siblings, if you have had your aunt or your uncle, then there is quite a bit of chance that you may get migraine. Age. Migraines can begin at any age, though it first often appears during adolescence. Migraines tend to peak during your 30s and gradually becomes less and less severe, less frequent in the following decades. But here is a first take-home message I would like you to take. Unlike other chronic conditions, say like diabetes, blood pressure, arthritis, back problems, migraine can occur in kids as young as 1 year. And they can last a long time, sometimes overnight or the next day. They're not in school, lying in the dark, hoping to fall asleep, which may arrest the migraines. Some kids have it 1 or 2 times a week. And in some cases, aspirin, Tylenol, ibuprofen does not even touch. And some of these young adults in their 15s, 16, 18s, 20s, when they go to the ER, they are treated with skepticism because they think that they are feigning migraines to get narcotics, pain medication. I'm aware that yes, people do get to the ER to get, but these are not the ones. These are the ones who need help. And they are in the ER for a long period of time because nobody believes them. So this is one message is very important, that unlike chronic conditions, it can happen to children. Third, gender. Women are 3 times more likely than men to have migraines. 75% of patients I have seen in my clinic over a period of time were women in their 20s, 30s, and rarely in their 40s. One other thing that I noticed was that psychological stress, excessive worry, like a worrywart, worrying about things which are not important, trivial things, tensed about something which is absolutely not important. Those are the people who tend to get these migraines. And finally, post-traumatic stress disorder. It may be sexual abuse. It may be a war in Iraq or in Afghanistan. It may be domestic violence. These things can trigger off later on headaches. So these are the risk factors. So let's go into the triggers. Now, certain foods and beverages will definitely trigger off a headache. And let me show that why. Because like aged cheeses, which contain a high content of histamine and tyramine, these are precursors of migraine. Salty and processed foods, again high quantity of tyramine, containing preservatives like your monosodium glutamate, MSG, found in many foods, or mostly in Chinese foods. So next time when you think of having Chinese food, think of asking the restaurant, please do not use MSG. And because I've seen that with Chinese food, people tend to get headaches, and the MSG is responsible. Smoked cured meats, same thing. So animal products, again, can cause because of a high content of omega-6, not omega-3, which increases inflammation. Dairy, the casein protein, is known for headaches in some migraine patients. Food additives like aspartame for sweetening your drinks. And finally, drinks. Alcohol, red wine has a lot of histamines and tannins. And finally, we talk about caffeine, which can narrow blood vessels, cause headaches, but this is a double-edged. Caffeine has been known to cause headaches, and caffeine has been known to treat migraine headaches, which we will talk about later on. Red wine, high amount of histamines and tannins. What else was it? Oh, yeah, skipping meals. This is what I found when I was a resident, that we had to skip meals and I would get a severe headache. And so I realized that it can happen to anybody, and especially if you're going out in the sun, or if it is too hot, you get a headache. If you're in the sun and had a drink, a beer or something, likely to get a headache. So all these are food products. But if you, not only food, but then you come across hormonal changes in women. So what do we have over here? We have fluctuations in estrogen before or during menstrual periods in women can cause a headache. Pregnancy and menopause also seem to trigger headaches in many people, but sometimes when you reach menopause, it's sometimes your headaches turn to disappear. So again, this is a bit of a controversial thing. Hormonal medications, oral contraceptives can worsen your migraines, but some women swear that their migraines occur less often when taking this hormonal medication. Stress. We come to stress. Stress at work or home can cause migraines. Again, it's that overstimulation of the sympathetic nervous system, ongoing, causing levels of cortisol to rise, that a chain of events can lead to migraine. Sensory stimuli. This is something I have found. Bright or flashing lights can induce migraines, as can loud sounds. I had a patient, trust me, I had a patient who turned around and would come to my clinic because he has passed an ambulance on the road. And with the flashing lights of the ambulance and the sound, he's got a migraine headache. So, strong smells. Here we had a doctor. In fact, we had to put a board outside that please, if you're wearing any eau de cologne or perfumes, please let us know, because this doctor would get a headache. Plus, an important message for all the doctors all over the world. Do not use your eau de cologne and things when you go to examine patients. You never know, you may get a patient a migraine. So, smoke. Secondhand smoke, pollution can trigger off a migraine in some people. Sleep changes, either sleeping for long periods of time. And everybody must have noticed that sometimes you go 12, 13 hours of sleep and you get up and you feel tired and you get a headache. So either you sleep too much or too little is a cause of migraines. Physical strain. Oh, I've seen people in the gym who do so much of strenuous and then they get a headache. Even increased sexual activity can provoke a migraine. Weather changes. If it gets too cold or too hot, you get a migraine. These are all possibilities, all triggers. Now, all of these may not depend on does not pertain to everybody, but you got to take into consideration a pressure change, whereby, lower pressure, tornadoes are this thing, this can stimulate or start a migraine headache. Medications, oral contraceptives, and vasodilators, like when you have angina and people take the nitroglycerin under the tongue, we warn the patients, you will get a headache. And erectogenic drugs like your Viagra can also cause, because of the vasodilatation, can induce a migraine. Dehydration, that can do it. I used to work in the Middle East, in Bahrain, and there would be some people working on the outside, extreme heat in the Middle East, and they would get a severe headache because they would be dehydrated. Another important thing is high altitude headaches. This is what happened when I climbed Mount Kilimanjaro. There was a person with us who had a severe, severe headache. Now, these are all timed, these things. So you have to take in 5 liters of fluids and you have to take a diuretic, because that headache is serious. That can cause a cerebral swelling. Your brain can swell, cerebral edema. So identifying all these triggers that I talked about helps you understand the risk factors, can empower you again to treat this in a better fashion. So far, we have discussed risk factors, we have discussed triggers, we have discussed what is migraine. Now, the next slide, this slide is as confusing as this picture. The reason being, the exact cause of migraine is complex and includes various factors, including genetics, environmental factors, and certain neurological processes. Just bear with me, don't remember names and all that, but just bear with me for 1 second. What happens in your brain and its interactions with the trigeminal nerve, the nerve that supplies the eye and your face? Sensations, pain sensations. Now, these may have a pathway, and these trigeminal nerve, along with the brainstem, may be involved. Imbalances in the brain chemicals also. Here, I would like you to pay attention. They're working a lot on the substance serotonin. You have to remember this. Serotonin, 90 to 95% of the serotonin is produced in the gut, but by your microbiota, gut microbiota. That means if it is not a diversified microbiome in the gut, your serotonin production will not be enough. That can lead to regulate pain and emotions in your nervous system, depression, headache, migraines. So here is the gut microbiota, gut-brain connection, the GBA. So remember that sometimes having a healthy gut bacteria helps in the migraine, not getting a migraine. This is important. And then there are other neurotransmitters. You don't really have to know the name. It's called the calcitonin gene-related peptide, which can cause with the neurotransmitters. So, but remember about the serotonin. Now, what do? We have these migraines, right? Now these migraines are, in a way, you have the first various phases. So let's look at the phases. You can progress through these certain phases. The first one is a prodromal phase. 1 or 2 days before migraine, you may notice, not all the people, but you may notice subtle changes in warn of an upcoming migraine. Now, what are these? You may get constipated, which you don't have usually. Mood changes from being depressed or extreme euphoria. Food cravings of certain types of foods. Neck stiffness, increased urination, fluid retention are all your prodrome. And I had one patient who said, he told me, I distinctly remember, a young gentleman who turned around and said that a few days before, I would keep yawning. For no reason, but I kept yawning. And then on the third day or the second day, I would get a headache. So prodrome, be careful. If you get these things, you know that you are going to get a headache if you are a migraine person, and then you can take some steps to avoid it. Aura. Not all the people get aura. For some people, an aura might occur before or during migraines. They're usually visual, but include other disturbances. Each symptom usually begins gradually. The aura builds up over several minutes and lasts to an hour. Examples of migraine auras include visual phenomenon such as seeing various shapes, bright spots, or flashes of light. Now, here I would like to stop and say one important thing. The rest of the things that I'm going to talk about, the visual loss, the pins and needles sensations in an arm or leg, weakness in the face or one side of the body, difficulty speaking, these are all aura. If you have these symptoms for the first time, you have to be evaluated further and go to the emergency room or to a doctor or neurologist. But once you've been worked up and you know that these things come around, then you can take it as an aura. Got it? So I'm not telling you that, okay, you get these, you sit at home for the first time. No, you should be going to the emergency room to rule out. But once they've ruled out everything and you get future attacks with the aura that I talked about, then that means that you are having this aura that is there. Then comes the attack. We saw the picture of that woman, the severe headache. It can last from 4 to 72 hours. We talked about the pain, the throbbing, the piercing, the pounding pain that is there. It may occur rarely or strike several times a month. It may last from 4 to 72 hours. Now, during a migraine attack, you can get one-sided headache, bilateral headache. You may get sensitivity to light, sound, and sometimes smell and touch. I tell you it is true because sometimes when you don't realize and you walk into it, when I walk into a room and the patient is there with a migraine, the lights off, not realizing, not really wanting to harm the patient in any way, but I put on the light and the patient jumps. And I say, what's wrong? And she's shattered because the sound and the light. So I've learned that if you have a patient who is there in the dark room, open the door, go slowly, sit down, talk softly to her, because these people are very prone to lights and sounds. Once the attack is over, you have the postdrome. You may feel completely drained, confused, washed out. And some people may feel elated because they don't have any pain. And sometimes I've noticed that when you are in the postdrome phase and you move your neck and you're happy and then you get a headache again for a few minutes. So here are your migraine phases. It does not mean that You have all the phases. You may not have all the phases, but understand, because when you want to manage symptoms in ward of an attack, it is important to know these phases. Now, having said this, let me just digress a little bit and talk about clinical presentation of headaches. Most of the time, the garden variety of, we see the garden variety migraines. So, what are the differences? In a migraine, can be unilateral or bilateral, and we compare it to a tension headache. A tension headache is always bilateral. In migraine, you can have a pulsating, throbbing headache. In a tension headache, it is pressing, and it is like not pulsating, but like a band of pain all over your head. In a migraine, may moderate or severe in intensity, while a tension headache will have mild or moderate intensity. A migraine can be aggravated by physical activity. A tension headache will not be aggravated by physical activity, and there will be nausea and vomiting in a migraine headache, whereby in tension, you may not get nausea and vomiting. So these are the two important things that come around. The third thing is sinus headaches, which, in my opinion, if your sinus infection congestion is treated and you still have the headache in your sinuses, it is migraine. One of the factors about this is you also cluster headaches. I don't know how many people have heard about it. I've seen probably 5 or 6 patients of cluster headaches, maybe a little more, yeah. But these headaches are excruciatingly painful. They're recurrent and they're cyclical. They keep coming. And the pain is described as so excruciating and intense, usually around one eye and one side of the head. And they can come, they're short-lived compared to migraines, but that typically lasts for 15 minutes, but it can go up to hours. And they can be multiple times during the day. And these cluster headaches can be followed by remission, and where the headaches may not occur for months or even years. Cluster headaches, remember, if a patient comes, if the patient has, if any one of you, that your one-sided headache, severe pain in the eye, you are actually teary-eyed, and your eyes are red, and you have a nasal congestion only on one part. You may be, and a facial sweating is another sign that is only on the affected side, not on the other side. So if you got a teary-eyed and nasal congestion and runny nose only on one side and excruciating pain, this can be your cluster headache. Now, so just to let you know, we are not going to get into the treatments in the morning, but just to let you know, worrisome headaches, red flags. If you have systemic symptoms such as fever, weight loss, fatigue, tiredness, it suggests an underlying infection and some kind of an infection or an inflammatory disorder. If you have neurological symptoms or abnormal signs like confusion, impaired consciousness, that should always raise concern. If it is a sudden onset, it is very important thing. Patients who have a sudden headache that peaks in seconds and minutes require really thorough assessment to include bleeds. hemorrhages in the brain tumor. So here was a new progressive headache that begins in middle age, or any headache that deviates significantly from the previous pattern should be investigated further. And this is what is, again, that I saw when I was working at the Goodyear Clinic way back. I saw a patient who was in his late 50s who came around and told me that he had a headache. I asked him how severe it was, all that was done. And then there's one important question that I asked him: is this the worst headache of your life? And he said, yes. So we sent him over to the emergency room. He had a subarachnoid hemorrhage. He was flown to Birmingham, and that saved his life. So if you have any neurological symptoms, or your headache is something which is not typical of what you had, then take it seriously. And we come to diagnosis. And we're not going to go, but I'll tell you one small thing. The garden variety of migraine, in most cases, a proper history and examination are sufficient to diagnose migraine. You do not require MRIs and CT scans and all that. We're talking about the garden variety, not those atypical symptoms. A typical diagnosis would require at least 5 episodes that last for 4 to 72 hours, among other criteria. But of course, your doctor will do and just check your blood pressure and all that. And if he finds any neurological, he'll send you, and there are further tests to be done, which we are not going to go into right now. So the important thing is treatment. How do you treat this? Migraine treatment is acute treatment, preemptive treatment before it happens, and preventative treatment. In acute treatment, your goal is to attack, to relieve the pain during an attack, and to relieve the pain and the disability, and to stop the progression of this attack further. Your preemptive treatment is used when you know of a headache trigger, such as what we talked about, extreme exercise or sexual activity. And for those patients experiencing a time-limited exposure, what does that mean? To a trigger. Say, for example, when I was on that Mount Kilimanjaro, that patient was not having enough fluids and not taking the diuretics, and he got the headache. He could have avoided. So that's a preemptive treatment. Even when you're menstruation, when you know that you are getting the headaches before or during, you can take some steps to reduce or avoid it. And finally, the preventative treatment is maintained for months or even years to reduce attack frequency, severity, and duration. Here, in preventative treatment, diet plays a big role in very, very many patients. So let's look at, there are a couple of other things besides that. Your lifestyle changes. Most important is diet. And, consistent sleep schedule, staying hydrated, managing stress by yoga, meditation, spirituality, religion, avoiding trigger foods, meats, eggs, cheese, and having excessive caffeine. Over-the-counter medications can provide relief for mild to moderate migraines. And there are certain alternative therapies like acupuncture, chiropractic care. Some of the patients tell me that has helped. So I don't know much about that, but that can be an alternative therapy. Always remember, if you're using painkillers, don't overuse, because overuse headaches can happen by medication. Aspirin, acetaminophen, caffeine, Tylenol is the one. Ibuprofen, for more than 14 days, you will get overuse headaches. Your triptans that are used in your migraines to avoid migraines, more than 9 days in a month, you can get overuse headaches. And now we come to diet and migraines. This is where I would like to people who are having migraines. Please, no matter what you do, try to avoid certain foods that can cause migraine. And if you can try and do that, it could help you a lot. So, number one that I did, what I found was that a low-fat, plant-based diet, low-fat, that causes fewer attacks and less intense headaches. So, you have your almonds and walnuts and all that, which can be not saturated fat, but still fats. Nut butters and vegetable oils. Try, if you're getting a headache, try to avoid these and see if your headaches get better. Have more of omega-3 fatty acids. They believe to help. Chia seeds, hemp seeds, flax seeds are good. Ginger has been, I think I knew a patient in India who used to get headaches, but used to take a piece of ginger and chew it. I don't know how you can chew a piece of ginger, but well, her headaches would disappear. It comes in capsule forms. It comes, and then there is this herb, feverfew, which is from the daisy and sunflower family, which was used for fever, and you have to take that, and it helps certain people in migraine. Now, when you take Tylenol, remember, I noticed a lot of my patients who would go on a binge drinking and then next morning have a hangover and a severe headache. At that time, it is better to take Tylenol and follow up with a caffeine beverage. It can be green tea, coffee, because caffeine potentiates the action of paracetamol or Tylenol. Dark green leafy vegetables have magnesium, which helps in migraine, and it also helps as a molecule that binds with that enzyme we talked about, the CRGP, and inhibits it so that you can avoid migraine. Now, let us look at the pain-safe and migraine trigger foods. The migraine diet, pain-safe foods are rice. Brown rice, black rice, anything that you have. These are pain-safe. You can have as much as you want. Cooked green, yellow, leafy vegetables. Green, yellow, orange. Can be collard green, squash, bell pepper, kale, carrots, what have you. But cooked. Cooked green and cooked or dried non-citrus fruits. Not grapes, not strawberries, but things, not pineapples, but things like apples, and which should be cooked. And these are pain-safe migraine trigger foods. What are common these are pain-safe foods, not migraine trigger. My mistake. Now, common migraine trigger foods are alcohol, caffeinated drinks, monosodium glutamate, aspartame, nitrates. We talked all about this. And then you have the dirty dozen: dairy, chocolates, eggs, citrus fruits, meat, wheat, nuts and peanuts, tomatoes, onions, corn. This is a bit apples and bananas. It's just like if you're allergic to strawberry, you may be allergic. But this is what the dirty, especially the dairy, chocolates, and eggs and citrus fruits, you have to, first of all, these are commonly migraine trigger foods. Now, according to the Journal of Headache and Medicine, certain foods can cause migraine while others can prevent or even treat them. The severity of participants' worst headache can improve significantly when they are consuming a plant-based diet. The decline in migraine pain have been due to the elimination of dietary pain triggers such as meat and dairy products, or because of the whole food plant-based diet reduces your weight and helps you in your hormonal changes to bring this change. First step is to check in your migraine is to check whether any of the common triggers that we talked about are causing them. To do this, you simply avoid these foods. At the same time, include generous amount of pain-safe foods in your routine and see whether migraines occur. If so, how often? So here is a way to start. For 2 weeks, have an abundance of foods from the pain-safe list. Avoid the common triggers. Foods that are not on either list, like eggplant or sweet potato, can be eaten as much as you want. If your diet changes, makes your headache disappear, great, or become less frequent, the next step is to confirm which foods are your triggers. To do this, reintroduce the eliminated foods one at a time every 2 days. Like if you feel bananas, and eat just 4 or 5 bananas for 2 days and see whether your symptoms come back or not. And then finally, we have the PCRM study. This is a Physicians Committee of Responsible Medicine that did this study in 2014 when 42 people with migraines and pounding headaches, half were put on placebo and the others on a diet change. First 4 weeks, no animal products at all. And if after 4 weeks with no animal products at all, you still have migraines, then eliminate the trigger foods, as we talked about, chocolate, citrus, meat, wheat, nuts, tomatoes, and all that. Avoid these in addition to being a vegan. Bring them one at a time, do that for a few days, and keep on eliminating that trigger food till the study is over. You may find that you have one trigger food, 2 or 3, and so when they asked the participants what was difficult, they said eliminating part was tougher than going vegan. Because when you eliminate wheat, that means you're thinking about your pizza crust going wheat. So look at triggers, and the foods that were chosen were on a hypothesis on previous research, because a lot of people will say, how come these foods were chosen? On previous research. And then look at triggers for inflammatory, like they looked at triggers for inflammatory diseases, like your rheumatoid arthritis or your skin disease. And they put them on a list. And you know what came on the top? Dairy came on top of the list. So have abundance of pain-safe foods, avoid common triggers, and that foods that are not on either list can be had as much as you want. And so my final thought for this is, over a period of years, recurring moderate to severe headache, which has been thoroughly investigated by doctors, neurologists, is migraine until proven otherwise. Thank you very much. I shall now stop screening, right? Hello.
Thank you, Dr. Akil. Yes, that is very good. And now we're going to ask everybody if you want to come back on camera. That would be awesome.
Hi, Sherry. I'm not seeing everybody, so maybe I'm.
There we go. You will
Oh,
see, you will see people who are on camera, people who are not being seen.
all
There we
right.
go. Now you've got everybody.
Okay, let's see. Any questions? Unmute yourselves.
Okay, I don't know why I can't get
Francine.
I don't know why I can't get any visual on there because I'm just not very savvy when it comes to computers, and I just got a new computer. I had to reinstall Zoom, so I may be unable to do any better than I am
I
right
see you.
now.
I see you.
Oh, okay.
See you. Great.
All right, thank you.
Any questions?
This one up there.
I just have a comment. I wanted to say I recently had an issue with headaches and I've been doing acupuncture and it's been very helpful.
I do believe I mentioned that in my this thing about that.
So thank you.
As an alternative. So, Julie, tell us a little bit about the acupuncture. Are they needling you in your back, in your temples? What?
The head, the ears, and the hands and feet.
Wow.
Excellent. Excellent.
Yeah.
And how long did it take for the results, Julie?
After about the first 6 times, each time it was getting better and better each time. So I would say after the 6th or 8th session, it was practically gone.
Wow.
Excellent.
Yeah.
You are a plant-based food person, right?
Absolutely.
Great. Great.
Awesome. Was there any indication that you may have been eating anything that was a trigger, or was it environmental, or did you notice anything unusual?
No, mine was not diagnosed as a migraine. It was just diagnosed as a primary cough headache because every time I would cough or sneeze or bend over, I would get a headache, sometimes 10 or 12 a day.
Oh my God.
And so I did go through the MRIs and all of that because they wanted to rule out everything. And then I got the acupuncture, and that, like I said, that has helped immensely.
But like Julie, I was saying that irrespective of what, once you ruled out other things, it is migraine till one otherwise. I've seen so many times, with people coming with sinus headaches. Oh, give me a shot. I've got sinus congestion. I say, you don't have sinus congestion. You've taken x-rays before. You do not have anything. You may be having a little bit of a runny nose or allergies. And when you put them and you tell them certain things, they respond. So they overdiagnose as sinus headaches and their migraines. Yes. Anybody else? It was lovely to have all of you over here.
Yes.
Irrespective, we are going to continue every month as long as we have topics that people can benefit from. That is all the things that I'm interested in. People should be able to get, whether we have got 5, we've got 40 people, that is immaterial to me. Let's continue this, spread the word around. The more we are, the better it is, more questions come in. Excellent.
So, Dr. Akil, Sherry has a question for you.
I'm asking on behalf of my sister-in-law. She's had years of severe migraines, and the only thing that's helped her is she goes regularly for Botox injections. And I wanted your thoughts about that. It has definitely helped. I don't think she's plant-based, but I know that the Botox injections have been the only thing that's helped the migraines.
Yeah. I have it in my slides, but I did not put that out because I wasn't talking about treatment on that basis. But Botox helps. If you try, my only point is this: if you can do by diet, plant-based, if you can do by diet, then you do not have to depend on whether it is acupressure, acupuncture. If, for example, Julie, now she is a plant-based and she did not go anywhere. So I'm perfectly okay with her to try that. In your case, Botox does help because it's a trigeminal nerve, the sensations. So what they do is, she has to take it every 3 or 4 months, I believe. It's not, and so it is okay if that helps her because it is excruciating. So if that helps her, good. But if you can just slightly needle her and tell her, try to eliminate, not even tell her go plant-based, eliminate the things like, what I talked about, the garlic and the onions and all that. Try to see if that can help her more. That's all.
So, Dr. Akil, is
Thank you.
cheese? I'm sorry. Go ahead, Francine.
No, I didn't have a question.
Oh, okay. Question that came up over here was, is cheese and dairy a large trigger to migraines?
Yes. Cheese, especially if it is aged cheese, because of the thiamine and the histamine, which is very high in these things. But overall, when they did for inflammatory diseases like rheumatoid arthritis and ulcerative colitis and migraines and other things, they found that the main culprit was dairy. So whether it is aged cheese or otherwise, the dairy is a culprit. And I've told so many people in all my talks that if you are you're on the fence, and you want to go plant-based, the first thing you give up is dairy. And you will definitely see, because why I'm saying is because it'll immediately within a week, it'll get you completely like your bloating and this, a distension, all that is going to get over. If you can. And there are so many alternatives to dairy.
No.
Non-dairy cheese, you can get non-dairy yogurt, you can get everything. So you're not missing out on your foods like your probiotic or your prebiotic, because your probiotic foods are lactobacillus and all those, and that comes in non-dairy yogurts, kombucha, all that.
So another question that came up was about children. Many of us are parents, and you mentioned that children get headaches, and sometimes they don't even know that they have a headache, right? But when they have enough of a headache that they mention it, what are some approaches that can be used when addressing this with the child?
The first thing is that do not be skeptical. And say, my child doesn't want to go to school, or is trying to avoid this and that. Give it a proper thought to the child when he or she is not having the headache, and get a proper history. Take that history to your pediatrician. Take that history to your pediatrician and talk to the pediatrician. Don't take the child when he's having a headache to the pediatrician. Make an appointment. Have the arsenal with you that these are the factors that my child has. Talk to your child. I mean, it's impossible because I've seen a 1-year-old. How can you talk to a 1-year-old? So the idea is that these are the people who need to be thoroughly investigated before they can come. But if you've got a 5-6-year-old, they'll talk to you. They'll tell you exactly what is happening. And once you get that, go over to your pediatrician and then discuss then these are the groups that are most, they can be helped most by diet.
Mm-hmm.
They're still not used to the processed foods and the meats and the dairies the way adults are. So once I think the beneficial effect to children with a plant-based food is far greater than in adults. But it's difficult, and then you have to try to make, as we have talked in my past lectures, make it interesting, let them come around, make foods with you, make those toy trains about the carrots going on this or that, and that should help. And they will be helped. And people can be thanked, because sooner or later, if it is not, then it becomes worse and worse. And then they get into adolescence, it becomes worse. And then they're labeled. Most of these people are labeled as drug seekers.
Mm-hmm.
No doubt, there is a thing, but you got to rule it out and talk to that person. The worst thing I've seen is, and I've worked in emergency room, urgent cares, by the primary care doctor, all that. And the worst thing, and I'm guilty of it too, in my heydays, oh my God, we got him again, or we got her again. Oh, she must have come for a headache. I didn't know. So the whole idea about these lectures, that I'm not really lectures, it's an interactive thing. And I want people to embrace what doctors don't tell you. So at least to embrace things so that you can tell your doctors, what about this? Would this work? And if they don't have answers, go to another doctor.
Very key, and thank you. And I had one last question to pop up. On one of your slides, you had a thing about anxiety and depression. And a lot of people don't really see the connection between anxiety and depression and migraines. Can you give us an example of that?
You see, what happens is, again, when you think about, as I explained to you in the serotonin, with the gut bacteria is responsible. The gut bacteria produces 90 to 95% of serotonin in the body. Now, if this serotonin is responsible for your moods, for your depression, for your headaches. So when you have this serotonin, which is causing this problem, if you have less of serotonin, you're bound to get some of these things. And when you talk about, I would put migraine into a chronic sort of a disease. See, another thing you must remember, that chronic diseases are all happening in the middle age, except migraine when it is the kids. But if you have this endorphins and all these things which are there, what really happens when you have anxiety or your stress? The starting point of stress and anxiety is your overstimulation of your sympathetic nervous system over a period of time. Once that happens, you start getting your blood pressure increase, you start getting cortisol more, you start eating more, you start putting on weight. And once you start putting on weight, then comes the diabetes, then comes the high blood pressure, the cortisol causing high blood pressure. And then these are, in anything, if you have comorbidities, that particular ailment will be tenfold. COVID for people who are healthy, they've hardly gone to the hospital or hardly been put on the incubators and all that. No. The people who have got high blood pressure, diabetes, obesity, high cholesterol, respiratory problems, smokers, these are the people who are put on ventilators. These are the people who go to the hospital. These are the people who are likely not to survive. So my main point is that when you have this depression, it is a chronic thing. And when this chronic thing along with your serotonin and all that, will definitely cause you to have problems in your brain. Like I was talking to a physician lately, and she told me that we've got 3 brains in our body. It's your gut microbiota, your enteric system, and your brain. So it does have an effect, and especially post-traumatic disorders. These are things that are there in you, unless and until with meditation and spirituality and religion and yoga and breathing exercises and medications in some cases. If it does not help, that means you are in a problem state whereby you can get depression, anxiety, headaches, abdominal pain, whatnot.
Which is why that plant-based diet is so important to bring in.
True.
Yes, yes.
True.
Wow. Well, thank you, Dr. Akil. This has been so informative. I can't wait for this to be finished recording and up on the website. And everyone, please do, as Dr. Akil said, share the information. Our January date and topic will be released when the replay comes out, when the recording gets released. So keep an eye out for that. If you have a topic that you'd like Dr. Akil to address, please email it to us.
Sure.
We're happy to add that into the mix. And most of all, we want you to know that we appreciate you. We wish you a wonderful holiday season. Merry Christmas, Happy Hanukkah, Happy Kwanzaa, Happy everything, and a Happy New Year. So unmute yourself and let's all share in the holiday spirit.
Yes.
Happy holidays to everyone. Happy holidays, everyone.
Happy holidays.
Yeah, thank
Blessings.
you.
Take care.
Namaste, y'all. Namaste.
Yeah, thank you so much.
Namaste. Thank you so much.
Thank you, everybody. Bye for
Thank
now.
you.